Good morning. Welcome to News for Hearing Impaired. I am Anil Thomas. With me, Manisha this morning. First up, the headlines. Home Minister Amit Shah directs authorities to take strict measures to prevent hoarding and black marketing of essential commodities and to ensure their smooth supply. Government says there is sufficient stock of food grains in the country. Indian Railways and Civil Aviation Department step up efforts to ensure adequate supply of food, medicine and essential commodities. FCI moves 20 lakh metric tons of food grains to ensure smooth public distribution system during lockdown period. Union Health Ministry does a comprehensive review of the containment strategy for COVID-19, issues guidelines for future approach. ICMR also issues guidelines for sample collection sites. 508 new corona positive cases reported in the last 24 hours in the country, bringing the number of active positive cases to 4,312. Death toll stands at 124. Maharashtra with 48 deaths and more than 1,000 positive cases continues to be the worrying hotspot. In international news, British Prime Minister Boris Johnson continues to be in the ICU for the second day. His condition is reported to be stable. New York registers new single-day high in COVID-19 deaths with 731 fatalities. China lifts 76-day-long lockdown from Wuhan. And now for the stories in detail. Starting first up with Union Home Minister Amit Shah directing the authorities to take appropriate steps in coordination with state governments to prevent hoarding and black marketing of commodities during the 21-day lockdown in the country to contain the spread of coronavirus. The directives were issued after a detailed review of essential commodities and implementation of the lockdown by the Home Minister, Amit Shah. The Home Minister has asked the authorities to take quick and stern action against people indulging in hoarding and black marketing of goods. Government is closely monitoring the movement of pharmaceuticals along with other essential items.
लॉकडाउन मेजर्स को इम्प्लीमेंट करने के लिए सबका सहयोग आवश्यक है। आने वाले सप्ताह में कई त्योहार हैं। इस संदर्भ में कई कम्युनिटी लीडर्स भी आगे आए हैं। उन्होंने कम्युनिटीज को आग्रह किया है और कर रहे हैं कि वे लॉकडाउन के स्ट्रिक्ट इम्प्लीमेंटेशन में सरकार का सहयोग दें। गृह मंत्री जी ने एसेंशियल कमोडिटीज और लॉकडाउन मेजर्स के स्टेटस का डिटेल्ड रिव्यू किया। उन्होंने निर्देश दिया है कि उपयुक्त कदम उठाए जाएं और राज्य सरकारों के साथ मिलकर सुनिश्चित किया जाए कि कहीं भी होर्डिंग और ब्लैक मार्केटिंग ना हो। ऐसा करने वालों के विरुद्ध सख्ती से और त्वरित गति से कार्रवाई हो।
Indian Railways and Civil Aviation Department have stepped up efforts to ensure adequate supply of food, medicine and essential commodities throughout the country. The aircraft flying under the lifeline Udan of Civil Aviation Ministry has transported 200 tons of cargo. Civil Aviation Minister Hardeep Singh Puri said on Tuesday that 152 flights have transported 200 tons of medical supplies to different parts of the country under the centre's Lifeline Udan initiative between March 26th and April 6th. These flights were operated to transport essential medical cargo to remote parts of the country to support India's war against COVID-19. Railways has also loaded 8,897 rakes and 4,57,000 wagons loaded with essential items till Monday. Food Corporation of India, that's FCI, has sent enough stocks to states throughout the country to implement PM Garib Kalyan Anna Yojana, that's PMGKAY, wherein 5 kilograms of food grains per person per month for the next 3 months has to be distributed free to all under the National Food Security Act beneficiaries. Many states like Uttar Pradesh, Bihar, Telangana, Assam, Himachal Pradesh, Meghalaya, Sikkim, Uttarakhand, Maharashtra, Gujarat, Haryana, Kerala, Mizoram have already started lifting food grains from FCI under the scheme. In course of the next few days, other states will also start lifting the food grains for distribution under the PMGKAY. Since the 24th of March, Food Corporation of India has moved an average of 1.44 lakh metric ton food grains per day as against the pre-lockdown daily average of about 0.8 lakh metric tons. A total of 658 rakes carrying about 18,42,000 metric ton grains have been transported across the country till April 6th. Another 63 rakes to carry approximately 1,76,000 metric ton food grains are being loaded today. Implementation by states and districts of cluster containment and outbreak amenable to management strategy action plans, classification of hospitals for management of COVID-19 patients, and the impact of lockdown and social distancing were key takeaways of the press conference addressed by the Union Health Ministry and Home Ministry on Tuesday. The Health Ministry outlined the districts where cluster containment strategies are showing results. The Health Ministry explained the impact of control rooms and the use of technology under the smart city concept. This is for surveillance of quarantine facilities, tracking the health of suspected patients and their contacts, real-time tracking of ambulances and training of doctors, among others. The government said it is closely monitoring the movement of pharmaceuticals and their movement has been stabilized with the help of trucks and with the decision to lift export restrictions on 14 drugs. The Health Ministry clarified that it is working in close coordination with the Ministry of Pharmaceuticals regarding the national requirement of hydroxychloroquine. It is assured that the required quantities of the drug will be available in India. The Indian Council of Medical Research has issued guidelines for sample collection sites for conducting medical tests for coronavirus infection. The decision was taken after several state governments suggested establishing sample collection sites in various parts of cities. This could speed up the process of testing and detection of COVID-19 patients in the country. A group of ministers under the chairmanship of Defence Minister Rajnath Singh in New Delhi reviewed the situation arising out of COVID-19. The GOM appreciated the decision of Union Cabinet headed by the Prime Minister Narendra Modi not to operate MP labs for the next 2 years. The GOM also praised the decision of 30% cut of salaries of MPs. The GOM also expressed gratitude to thousands of health professionals, security personnel and countless others involved in ensuring smooth operation of essential services and supply chain of food, medicines, etc. The ministers were briefed that the supply of essential goods was continuing smoothly and no concerns were reported in this regard. The GOM appealed to people to follow Prime Minister Narendra Modi's suggestion by making contribution in feeding the needy people, making face masks at home and maintaining social distancing. The GOM noted with satisfaction that essential commodities were available in sufficient quantities and no shortages were reported from anywhere in the country. GOM felt that places where public have a tendency to gather in large numbers, such as religious centers, should be closely monitored and any such gatherings be prevented. Increased monitoring through drones was also suggested. The GOM recommended measures to enhance the testing facilities in medical laboratories. The GOM appreciated the decision that allowed agricultural operations during the current harvest season. It also expressed satisfaction over measures put in place to provide shelter and food to migrant workers. This was the 4th meeting of the GOM on COVID-19 since March 25th. President Ramnath Kovind has approved the ordinance amending the Salary, Allowances and Pension of MP Act 1954, reducing the allowances and pension by 30% with respect to 1st of April 2020 for a year. Earlier on Monday, the Union Cabinet had approved an ordinance amending the Salary, Allowances and Pensions of Members of Parliament Act 1954 to reduce the allowances and pension by 30% with effect from April 1st for a year. A bill to replace the ordinance will be brought in the next session of Parliament. Meanwhile, 508 new corona positive cases were reported in the past 24 hours in the country, bringing the number of active positive cases to 4,312. 124 people have lost their lives due to COVID-19. Maharashtra, with 48 deaths and more than 1,000 positive cases, continues to be the worrying hotspot. 352 people have been cured and discharged from hospitals. Well, there is a lot of speculation in the country with regards to the extension of the 21-day lockdown period, which was announced till 14th of April. According to the top sources of the government, many state governments have appealed to the central government to extend the lockdown. Many experts have also appealed to the central government to extend the ongoing lockdown in the country. Along with Telangana Chief Minister, other chief ministers have suggested government about the extension. Madhya Pradesh government has also said that lockdown shall be extended in the state if needed. Addition to this, Rajasthan government has also said they will accept the centre's suggestion on extension of lockdown in the state. On the other hand, Uttar Pradesh government has also mentioned that if a single case of coronavirus remains in the state, then the lockdown will not be opened. However, Health Ministry in a press release said that no decision on extension has been taken.
लॉकडाउन के कारण जो तबका सर्वाधिक प्रभावित हुआ है वह है फेरी नीति से आच्छादित होने वाले ठेला है, खोमचा है, रेड़ी है, पटरी व्यवसायी है, रिक्शा है, ई रिक्शा है, पल्लेदार है। इन सभी लोगों को भी हम लोगों ने 1,000 रुपये प्रति यानी इनको उस पूरे प्रति लाभार्थी देने की भरण पोषण भत्ते के रूप में देने की व्यवस्था की है।
The Innovation Cell of Ministry of Human Resource Development, AICTE, has launched a mega online challenge, Samadhan, to test the ability of students to innovate. The students participating in this challenge will search and develop such measures that can be made available to the government agencies, health services, hospitals and other services for quick solutions to the coronavirus epidemic and other such calamities. Apart from this, through this Samadhan challenge, work will be done to make citizens aware, to motivate them to face any challenge, to prevent any crisis and to help people to get livelihood. Under the Samadhan challenge, the students and faculty will be motivated for doing new experiments and bringing forth new discoveries and providing them with a strong base leading to a spirit of experimentation and discovery. The success of this program depends on how effective are the ideas of participating contestants with the ability to find solutions technically and commercially, which in turn will help fight the epidemic like coronavirus. Applications to participate in this competition have started from April 7th. The last date for submission of application is 14th of April. Moving to international stories, with the British Prime Minister struggling with the deadly coronavirus, British Foreign Minister Dominic Raab showed his confidence that the Prime Minister would pull through because he's a fighter. Raab also said that Boris Johnson, who's being shifted to the intensive care unit, remains stable overnight and is receiving standard oxygen treatment. Although the Foreign Minister denied of Johnson being put on ventilator support. Boris Johnson's personal battle with the virus has shaken the government, just as the United Kingdom now in its third week of virtual lockdown, which has already killed at least 6,159 people. In the United States of America, New York has recorded 731 new coronavirus deaths, making its biggest single-day jump. The state's death toll since the beginning of the outbreak last month grew to 5,489. The alarming surge in death comes even as new hospital admissions have dropped on average over several days, a possible harbinger of the outbreak finally leveling off. The state has been recording more than 500 new deaths a day since last week. The number of confirmed cases, which does not include infected people who have not been tested, is close to 1,39,000 statewide. In order to provide for every coronavirus patient, the Cathedral Church of St. John the Divine, the United States Naval Ship Comfort, and the Jacob K. Javits Convention Center in New York have been turned into makeshift hospitals in the fight against the virus. 1,000-bed facility was erupted at Jacob Javits Convention Center, while the U.S. Navy Hospital Ship Comfort will start by taking up to 500 coronavirus patients. However, 400 beds were delivered to the Cathedral Church of St. John the Divine, which is expected to receive patients by next week. These makeshift hospitals become another such arrangements as the number of coronavirus patients pile up in the city. U.S. President Donald Trump said that the federal government had 8,675 ventilators in a national stockpile available to states who need them. He added that another 110,000 are to be delivered in the coming weeks. The president also said that the United Kingdom has asked for 200 ventilators as support from them. However, New York's COVID-19 response has deepened as the state recorded single highest day increase in virus deaths on Tuesday. In the United States, coronavirus has killed more than 10,000 people, while more than 367,000 are infected from the virus. U.S. President Donald Trump has meanwhile announced that he would put a hold on America's funding to the World Health Organization, accusing it of becoming China-centric and criticizing its early guidance aimed at countering the international spread of the coronavirus pandemic. The Geneva-headquartered World Health Organization receives vast amounts of money from the United States. Trump's claims that the WHO is China-centric are the latest in a growing trend of conservative criticisms waged at the organization. Trump's remarks come on the heels of the calls for an investigation into the WHO. Meanwhile, in China, the lockdown that served as a model for countries battling the coronavirus around the world has ended after 11 weeks. Chinese authorities are allowing residents of Wuhan once again to travel in and out of the sprawling city where the pandemic first began. As of just after midnight Wednesday, the city's 11 million residents are now permitted to live without special authorization as long as the mandatory smartphone application powered by a mix of data tracking and government surveillance shows they are healthy and have not been in recent contact with anyone confirmed to have the virus. Restrictions in the city, where most of China's more than 82,000 virus cases and over 3,300 deaths were reported, have been gradually relaxed in the recent weeks as the number of new cases steadily declined. The latest government figures reported on Tuesday list no new cases. Moving to Europe and Spain in particular, the number of discharged patients from hospitals surpassed 40,000, according to the country's Health Emergency Committee head, Maria Jose Sierra. Patients were seen leaving intensive care units as health workers cheered as Spain's pace of new coronavirus deaths slowed for the fourth day. As with worst-hit Italy, data in Spain is giving cause for hope. Spain has been in lockdown since March 14th, with streets and the famous tourist site almost silent. Neighboring France has registered more than 10,000 deaths from COVID-19 infections, becoming the fourth country to go beyond the threshold after Italy, Spain and the United States. However, the rate of increase of fatalities is up for the second consecutive day. France Public Health Authority has said that the number of people who died from the virus has risen by 9% in a day. He added that the total death toll from the disease rose to 10,328 from 8,911 on Monday, with an increase of 16% in comparison to the earlier rate of 10% on Monday and 7% on Sunday. A total of 78,167 confirmed cases of the virus have been confirmed till now. Over 30,000 people remain hospitalized for COVID-19 in France. That includes 7,131 patients needing intensive care. Although he stressed that the day-to-day increase of intensive care cases has been diminishing. The Israeli government announced on Tuesday a new regulation requiring people to wear masks in public in order to help stop the spread of COVID-19 pandemic. Israel Prime Minister Benjamin Netanyahu told Israelis last week to wear masks in public and that it would become mandatory as Israel enters a Passover Seder lockdown. As of now, the country has reported more than 9,000 confirmed cases of the virus and 65 deaths. In Colombia, the army is blasting messages from helicopters over densely crowded areas and is also issuing fines. The country's military is deploying all kinds of methods to ensure compliance with the national quarantine to curb the spread of COVID-19 pandemic. The Andean country is in the midst of an obligatory isolation that began late last month and is set to last until April 27th. Healthcare workers, members of the military and the police and the staff in grocery stores, pharmacies, food factories and banks are allowed to go out. Otherwise, just one person per family can leave home to buy groceries and carry out financial transactions. These aerial patrols are being carried out in the capital and other cities across Colombia that has reported more than 1,500 infections and over 40 deaths. Denmark, meanwhile, plans to reopen the daycare centers and schools for children in from the 1st to the 5th grade on April 15th as a first step to gradually relax a 3-week lockdown to curb the spread of COVID-19 pandemic. The Nordic country, which has reported more than 180 deaths, was one of the first European nations to announce the closure of schools, daycares, restaurants, cafes and gyms and shut all borders to most foreigners. On Tuesday, Norwegian Prime Minister Erna Solberg also announced that Norway would relax restrictions gradually after the lockdown is lifted. Kindergartens, schools from the 1st grade to the 4th grade will reopen from April 27th, and Norwegians can go to their chalets from April 20th. As the coronavirus pandemic has tightened its grip around the world, in Bolivia, authorities seek creative ways to educate their population about the COVID-19 and its prevention. 2 people in coronavirus costumes visited a market in La Paz, asking people to respect restrictions on public gatherings and educate them on how the highly contagious disease is spread. Bolivia has taken aggressive measures to slow the spread of the disease, including a nationwide quarantine and closing the country's borders. Bolivia has reported 194 confirmed cases of the virus and 14 deaths so far. Veteran Indian American journalist Brahmakant Bhutlah has died of COVID-19 that is ravaging New York. the epicenter of the pandemic in the United States. Brahmakant Bhutlah was a correspondent for United News of India. During his 28-year career in the United States, he has worked for 11 years as a content editor for Merger Markets, a financial publication, and also did a stint with News India Times Weekly newspaper. He had emigrated to the United States in 1992 after having worked for several publications in India. Prime Minister in a tweet said, deeply anguished by the passing away of Indian-American journalist Brahmakant Bhutlah, he will be remembered for his fine work and efforts to bringing India and USA closer. Condolences to the family and friends. Om Shanti. That's all we have time for in this edition of news. But remember, stay safe, stay indoors. Bye-bye.